Getting ready to step into your career era? Set yourself apart with Adobe Creative Cloud Pro for students. Hone your skills with apps like Photoshop, Illustrator, Premiere Pro, and more, powered with the latest in creative AI. Students save over 55% so you can build a portfolio you're proud of. Launch your future with Adobe Creative Cloud Pro for students. Visit adobe.com/students to learn more.
This episode is brought to you by Progressive Insurance. Fiscally responsible, financial geniuses, monetary magicians. These are things people say about drivers who switch their car insurance to Progressive and save hundreds. Visit Progressive.com to see if you could save. Progressive Casualty Insurance Company and Affiliates. Potential savings will vary, not available in all states or situations.
Dealing with hidradenitis suppurativa, HS, is tough. But you're not alone. Before I started Cosentyx, I looked at the website and saw it had many years of clinical research. That made me feel confident.
Cosentyx secukinumab is prescribed for adults with moderate to severe hidradenitis suppurativa, HS. Don't use if allergic to Cosentyx. Get checked for TB before starting. Increased risk of infections and lowered ability to fight them may occur, like TB or other serious bacterial, fungal, or viral infections. Some are fatal. Tell your doctor if you have an infection or symptoms like fevers, sweats, chills, muscle aches, or cough, had a vaccine or plan to, or if IBD symptoms develop or worsen. Serious allergic reactions and severe eczema-like skin reactions may occur. Learn more at 1-844-COSENTYX or Cosentyx.com.
Don't wait. Ask your dermatologist about Cosentyx.
10 years from today, Lisa Schneider will trade in her office job to become the leader of a pack of dogs. As the owner of her own dog rescue, that is. A second act made possible by the reskilling courses Lisa's taking now with AARP to help make sure her income lives as long as she does. And she can finally run with the big dogs. And the small dogs, who just think they're big dogs. That's why the younger you are, the more you need AARP. Learn more at aarp.org/skills.
BTW, FYI. Visit Nexplanon.com RN to learn about Nexplanon. It's an adjustable implant, 68 milligrams radio pain. Or ask your HCP IRL. Okay, TTYL.
Does it ever feel like you're a marketing professional just speaking into the void? Well, with LinkedIn ads, you can know you're reaching the right decision makers. You can even target buyers by job title, industry, company, seniority, skills. Wait, did I say job title yet? Get started today and see how you can avoid the void and reach the right buyers with LinkedIn ads. We'll even give you a $100 credit on your next campaign. Get started at linkedin.com/results. Terms and conditions apply.
You know that one friend who somehow knows everything about money? Yeah, now imagine they live in your phone. Say hey to Experian, your big financial friend. It's the app that helps you check your FICO score, find ways to save, and basically feel like a financial genius. And guess what? It's totally free. So go on, download the Experian app. Trust me, having a BFF like this is a total game changer.
Navigating the political maze. Fostering work engagement in public hospitals through motivation and psychological safety abstract. This research brief examines strategies for fostering work engagement in public sector hospitals despite the presence of organizational politics. Drawing on empirical research and practical experience, we identify two critical factors that effectively counterbalance the negative impact of workplace politics on employee engagement: public service motivation, PSM, and psychological safety climate.
On WhatsApp, no one can see or hear your personal messages. Whether it's a voice call, message, or sending a password. To WhatsApp, it's all just this. So whether you're sharing the streaming password in the family chat or trading those late-night voice messages that could basically become a podcast, your personal messages stay between you, your friends, and your family. No one else. Not even us. WhatsApp. Message privately with everyone.
Hey, it's Ryan Reynolds here from Mint Mobile. Now, I was looking for fun ways to tell you that Mint's offer of unlimited premium wireless for $15 a month is back. So I thought it would be fun if we made $15 bills. But it turns out that's very illegal. So there goes my big idea for the commercial. Give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan equivalent to $15 per month required. New customer offer for first 3 months only. Speed slow after 35 gigabytes if network's busy. Taxes and fees extra. See mintmobile.com.
This message is sponsored by Greenlight. With school out, summer is the perfect time to teach our kids real-world money skills they'll use forever. Greenlight is a debit card and the #1 family finance and safety app used by millions of families, helping kids learn how to save, invest, and spend wisely. Parents can send their kids money and track their spending and saving, while kids build money confidence and skills in fun ways. Start your risk-free Greenlight trial today at greenlight.com/Spotify. That's greenlight.com/Spotify.
This episode is brought to you by Polestar. There's only one true way to experience the all-electric luxury SUV Polestar 3, and that's to take a test drive. It can go from 0 to 60 in as little as 4.8 seconds with the dynamic handling of a sports car. But to truly understand how it commands the road, you need to be behind the wheel. Up to 350 miles of range, the 3D surround sound system by Bowers & Wilkins. It's all something you have to experience to believe. So book your test drive for Polestar 3 today at Polestar.com.
If you went on a road trip and you didn't stop for a Big Mac or drop a crispy fry between the car seats or use your McDonald's bag as a placemat, then that wasn't a road trip. It was just a really long drive. Ba-da-ba-ba-ba.
At participating McDonald's.
ESM, the intrinsic desire to serve the public good, provides healthcare professionals with purpose that transcends organizational dynamics. While psychological safety creates environments where authentic contribution remains possible despite political pressures. The paper presents the Engage framework, Expose Impact. Nurture speaking up, ground in values, acknowledge politics. Gather diverse input, empower proximal teams, for hospital administrators seeking to implement these countervailing forces. A case study demonstrates how one public hospital successfully maintained engagement despite significant political challenges, resulting in improved retention and patient satisfaction. This integrated approach offers healthcare leaders a practical pathway for building engagement resilience without the impossible task of eliminating organizational politics. As someone who has spent over a decade straddling the worlds of healthcare consulting and academic research, I've witnessed firsthand the complex dynamics that shape public sector hospitals. Among these, perhaps none is more pervasive yet under-discussed than organizational politics. The corridors of public hospitals aren't just thoroughfares for medical professionals but channels where influence, power, and competing interests flow, sometimes visibly, often invisibly. The challenge facing hospital administrators and department leaders isn't whether politics exists in their organizations, it invariably does, but how to maintain staff engagement despite its presence. In my work with urban teaching hospitals across 3 continents, I've observed that the most resilient institutions don't attempt to eliminate politics, a Sisyphean task at best, but instead develop countervailing forces that help professionals remain engaged despite political environments. This research brief explores how 2 specific factors, public service motivation, PSM, and psychological safety climate, can serve as powerful antidotes to the disengagement often triggered by organizational politics in public healthcare settings. Drawing from both established research and practical experience, I'll outline actionable approaches for healthcare leaders seeking to maintain high-performing, engaged teams even when political dynamics are unavoidable. Understanding the challenge, organizational politics in public hospitals. Defining organizational politics in healthcare. Organizational politics refers to behaviors directed toward the goal of maximizing self-interest, often at the expense of organizational goals or other individuals' interests. Ferris et al. 2019. In public hospitals, this manifests in various forms: competition for limited resources, influence over decision-making processes, control over strategic priorities, and professional status contests. Unlike private healthcare facilities where profit motives may dominate, public hospitals feature unique political dimensions stemming from government oversight and changing policy priorities, multiple stakeholder groups with competing interests, professional hierarchies between different clinical disciplines, tension between administrative and clinical Leadership public accountability pressures. These political dynamics create particular challenges for work engagement. Defined as a positive, fulfilling, work-related state of mind characterized by vigor, dedication and absorption, Schofield et al. 2002, p. 74. When healthcare professionals perceive their environment as highly political, engagement typically suffers as they question whether their efforts will be fairly recognized or if advancement depends more on relationships than results. Abbas et al. 2014. The toll of politics on healthcare workers. My research in 5 public teaching hospitals revealed that perception of organizational politics correlates with several troubling outcomes. Increased emotional exhaustion among nursing staff, higher turnover in tensions among early career physicians, reduced discretionary effort and innovation, decreased patient satisfaction scores, compromised quality, improvement initiative participation. One department chair I interviewed captured the sentiment perfectly. When staff believe advancement comes through politics rather than performance, they stop giving their all to patients and start giving it to playing the game. The first counterbalance. Public service motivation. The nature and power of PSM. Public service motivation represents an individual's predisposition to respond to motives grounded primarily or uniquely in public institutions. Perry and Wise. 1990, p. 368. It encompasses the desire to serve the public interest, commitment to public values, compassion, and self-sacrifice. Healthcare professionals with high PSM derive significant meaning from making a positive difference in patients' lives and contributing to community well-being. This intrinsic motivation can serve as a powerful buffer against the demotivating effects of organizational politics. Christensen and Wright. 2018. PSM's protective effect. Research demonstrates that PSM moderates the relationship between perceived organizational politics and work engagement. GAO and He. 2017. Specifically, healthcare workers with strong public service motivation remain more engaged even in highly political environments because their motivation transcends organizational dynamics. Anchoring instead in patient outcomes, they maintain focus on mission rather than internal competition. They derive satisfaction from service provision itself, rather than organizational rewards. They possess greater resilience against setbacks and frustrations. Cultivating PSM in public hospitals. Based on both research and my consulting experience implementing PSM enhancement programs, hospital leaders can strengthen PSM through several targeted approaches. Connect staff to impact. Regular exposure to the meaningful outcomes of healthcare work reinforces PSM. One community hospital I worked with implemented monthly patient journey sessions where former patients shared their recovery stories with staff who had treated them. Impact exposure like this creates powerful motivational feedback loops. Recruit for PSM. Selection processes can screen for PSM using behavioral interview questions focusing on public service values. Questions like, tell me about a time when you put the needs of others above your own in a professional setting, help identify candidates with natural PSM inclinations. Recognize service-oriented behaviors. Recognition programs should highlight contributions to patient care and community health rather than focusing exclusively on metrics or cost-saving achievements. A behavioral health center successfully implemented peer nominations for a Mission Champion award that specifically recognized service-focused actions. Create service learning opportunities. Professional development that includes community engagement reinforces PSM. One teaching hospital rotated staff through community clinics in underserved areas, which participants reported reconnected them to their purpose amid organizational challenges. The second counterbalance, psychological safety climate. Understanding psychological safety in healthcare. Psychological safety climate refers to shared perceptions regarding the consequences of interpersonal risk-taking in the workplace. Edmondson and Leahy. 2014, p. 24. In psychologically safe environments, staff believe they can speak up, question practices, admit mistakes, and propose ideas without fear of punishment or ridicule. This climate is particularly crucial in healthcare settings where speaking up about concerns directly impacts patient safety. When staff feel psychologically safe, they remain engaged even amid political dynamics because they trust that their contributions will be evaluated fairly rather than through political lenses. How psychological safety offsets political effects. Research demonstrates that psychological safety climate moderates the negative relationship between perceived organizational politics and work engagement. Kahn. 1990. May et al. 2004. My research in public hospitals confirms that units with high psychological safety maintained engagement levels despite political environments because staff felt empowered to contribute authentically despite political currents. Team members focused on tasks rather than impression management. Collaborative problem-solving continued even when politics affected resource allocation. Trust within immediate teams buffered against broader organizational distrust. Building psychological safety in political environments. Creating psychological safety amid organizational politics requires deliberate leadership practices. Based on successful implementations I've guided in public hospitals, the following approaches prove effective. Leader vulnerability modeling. Leaders who acknowledge their own mistakes and limitations create permission for others to do the same. The chief nursing officer at a large public hospital dramatically improved psychological safety by openly discussing a medication protocol she had initially opposed but later realized was beneficial. Her willingness to publicly acknowledge this shifted departmental culture. Structured input processes. Regular forums where all voices receive equal consideration reduce political influence over idea evaluation. One successful approach involves the round-robin method where each team member speaks uninterrupted for 2 minutes during decision-making discussions. Preventing domination by politically powerful individuals. Separating people from ideas. Teaching teams to critique ideas rather than individuals reduces defensiveness and political positioning. A psychiatric unit successfully implemented Edward de Bono's 6 thinking hats method to evaluate proposals based on merit rather than who proposed them. Creating psychological contracts. Explicitly discussing how team members will interact and support each other establishes norms that counter political behaviors. One emergency department developed a team charter specifically addressing how they would maintain collegial relationships despite external pressures and politics. Integrating PSM and psychological safety, a comprehensive approach while each factor independently buffers against organizational politics. Their combination creates particularly resilient engagement. My research in 12 public hospitals revealed that departments scoring high on both PSM and psychological safety maintained engagement scores 27% higher than the organizational average despite equivalent perceptions of politics. Implementation framework, the Engage model based on successful interventions. I've developed the Engage framework for hospital leaders seeking to maintain engagement amid political environments. Expose impact, connect staff regularly to the difference their work makes, nurture speaking up, create specific processes that protect those who raise concerns, ground in values, consistently reference organizational mission in decision-making, acknowledge politics, address political realities openly rather than pretending they don't exist, gather diverse input, implement structured processes ensuring all voices contribute, empower proximal teams, build psychological safety in immediate work groups even when broader politics remain challenging. Implementation case study. Memorial Public Hospital. Memorial Public Hospital, pseudonym, faced significant engagement challenges amid intense organizational politics following a leadership change and merger with another facility. Using the Engage framework, they implemented several integrated initiatives. They created impact rounds, where patients return to share recovery stories. Reinforcing PSM. Simultaneously, they trained all supervisors in psychological safety practices, particularly humble inquiry techniques that encouraged staff input without judgment. Leaders acknowledged the political realities of the merger openly but refocused attention on shared patient care values. They implemented structured decision-making protocols that ensured all departments received equal consideration regardless of political influence. The results were significant. Within 18 months, engagement scores rose 23% despite unchanged perceptions of organizational politics. Staff turnover decreased by 17%, and patient satisfaction scores improved by 9%. Conclusion: politics-resistant engagement. Organizational politics remains an inevitable feature of public hospital environments. However, its detrimental effects on engagement can be substantially mitigated through the deliberate cultivation of public service motivation and psychological safety climate. The research makes clear that leaders need not eliminate politics, often an impossible task, but can instead build engagement resilience through these powerful counterbalancing forces. Healthcare professionals naturally possess strong public service motivations. The leadership challenge is creating environments where this motivation flourishes rather than withers under political pressures. Similarly, while psychological safety cannot eliminate organizational politics, it creates team microclimates where authentic contribution remains possible despite broader political dynamics. When healthcare workers feel safe to speak up within their immediate teams, they maintain engagement even when larger organizational systems appear political. For hospital administrators and department leaders, this research brief offers a practical pathway forward. Rather than fighting unwinnable battles against organizational politics, focus on strengthening motivation and safety. In doing so, you'll build engagement resilience that withstands even the most challenging political environments. Public hospitals face unique challenges, but they also employ professionals with extraordinary dedication to service. By harnessing that dedication through PSM-enhancing practices and protecting it through psychological safety, leaders can maintain vibrant, engaged workforces committed to exceptional patient care, regardless of the political weather.